Good morning, everyone. Welcome and thank you for joining us for this video. My name is Crystal and I'm the Public Policy and Advocacy Director at NAMI Wisconsin. Thanks for tuning into this video. We are so grateful that folks from all over Wisconsin and the country have one thing in common, and that is ending the stigma surrounding mental illness and promoting recovery. In this video, we're going to take a deep dive into current legislative issues that are determined by our grassroots network of members. So let's get started. With each of these slides, I want you to think about ways in which these issues relate to your own life or the life of your loved ones. The first issue that NAMI members have long supported is expansion of Badger Care, which is Wisconsin's Medicaid program, to include people who make up to 138% of the federal poverty level. That didn't make it through the legislature this last time around, but NAMI members continue to prioritize it. So if that number doesn't really make a lot of sense in your mind, for a single household of one, an individual at 138% makes $17,774 a year, and a family of four makes $36,570 a year. Badger Care is the largest funder of mental health services and offers a diversity of programs that are not offered under marketplace plans, such as individualized placement and support, comprehensive community services, community support program, and peer specialist services. By taking these federal dollars, Wisconsin would also be saving millions in which could be funded back into essential community-based programs. So once we have mental health coverage, where can we go to access these services? NAMI supports regionalized crisis stabilization centers so folks can get help in a crisis not far from their communities. We also support peer-run recovery services, recognizing the importance of someone who identifies as a peer or someone with lived experience to help us along our recovery journeys in various different settings is invaluable. Next, let's talk about a game changer that when we entered this pandemic, it was widely utilized over the past year. Though not for everyone, it's helped hundreds of people with mental illness continue to remain in treatment while stuck in their homes. So we want to ensure that once this pandemic is over, it remains an option for those who want to continue with it, and that it's covered by insurance in the same way an in-office visit would be covered. One important aspect of accessing telehealth is ensuring everyone has access to broadband internet. At this time, many parts of the state have insufficient access and dead zones. Finally, I'm really excited to tell you guys about something new. Recently, a piece of federal legislation was passed making the number 988 the National Mental Health Crisis number. So anywhere at any time, you can call that number and receive help if you're in a crisis. But where we need your advocacy is at the state level. As it makes its way down to the states, there are likely going to be challenges in the implementation process, such as securing funding to get it up and running, and we'll have to build up our capacity to serve folks in a timely manner. All in all, though, it's a good thing. Our next issue we are going to talk about today is boosting our behavioral health workforce. Here in Wisconsin and nationwide, actually, we face a significant shortage of qualified mental health professionals, including psychiatrists and child and adolescent psychiatrists. One of the most significant factors driving this is that many of these professionals are nearing retirement and the state is not replacing them fast enough to meet current needs. Other contributing factors include geographic disparities. Some northern counties share one psychiatrist across 3 counties, low pay compared with other medical professions, isolation, burnout, student loan debt, and lack of diversity in the workforce. Our providers should look like us and speak our language and understand our culture. This is an issue that we need the legislature to take a comprehensive look into. We cannot boost the entire workforce with one bill or one stroke of a pen, so we need a package of initiatives. In addition, we support employment opportunities for certified peer specialists and trained community health workers specializing in mental health. We can't afford to undervalue them or underutilize them in our mental health system. We know that jails and prisons hold disproportionate number of people with mental illness, and we need to find a better way. People with mental illness conditions need access to treatment, and our youth and adult justice system should not be the gateway to get there. We have some wonderful CIT, crisis intervention teams that are trained in how to de-escalate and refer someone to treatment, but they and the communities that they serve face an additional challenge in that they are spending a lot of time and resources transporting people who are in a mental health crisis to Winnebago Mental Health Institute for purposes of emergency detention. That means people aren't getting the help that they need on the front lines, and they're finding themselves in crisis. So this can be a very distressful experience for an individual being transported. So we need different transport options and more available options closer to home. Next, NAMI Wisconsin supports the Treatment, Alternatives, and Diversion program, which allows nonviolent offenders to be diverted from jails to appropriate behavioral health services and supports under supervision of the courts. We also support the expansion of specialty treatment courts like mental health and drug treatment courts so more folks can be eligible. Last but certainly not least is youth mental health. We know that youth need access to appropriate school and community-based mental health services and peer supports during the first signs of mental, emotional, or behavioral challenges. This is an incredibly difficult time for students as they navigate online learning, are away from their teachers and peers, and might be experiencing some additional feelings of isolation or depression. So now is certainly the time to invest in virtual and safe school-based mental health programs. In order to do that, we need our teachers to be armed with the right tools in order to identify certain risk factors and warning signs in our youth. So NAMI supports a training for educators called Youth Mental Health First Aid that can assist with that. All right, so in a nutshell, we need to expand Badger Care to 138% of the federal poverty level, grow the behavioral health workforce, provide access to affordable community-based treatment services, strengthen relationships between justice systems and communities, support youth mental health initiatives, and so much more. So if you have any questions, I'd love to connect with you. There's how to get in touch. For all those watching, thank you for all you do to help NAMI achieve its mission.